Zika. Zika is an infectious disease caused by Zika virus. It is a mosquito-borne disease, and the Aedes aegypti mosquito is the main vector, but other Aedes species can also transmit the virus. Sexual transmission via semen has also been reported recently. The virus is found in parts of South and Central America, the Caribbean, the Pacific Islands, Africa, and Asia. Most common symptoms of Zika are headache, joint pain, red eyes, muscle pain. If a pregnant person has Zika symptoms, her baby is more likely to have birth defects. It's linked to microcephaly, a condition where babies are born with abnormally small heads and underdeveloped brains. It can cause other neurological complications, such as seizures and developmental delays. Rabies. Rabies is a deadly disease caused by a virus that attacks the central nervous system. The virus is present primarily in the saliva, brain tissue, and spinal fluid of a rabid animal. Rabies is more common in bats, skunks, raccoons, coyotes, and foxes, but the disease also has been found in deer and in large rodents, such as woodchucks. Cats, dogs, and livestock can also get rabies if they are not vaccinated. People usually are exposed to the rabies virus when an infected animal bites them. Exposure may occur if the animal's saliva enters an open cut or mucous membrane. When a person gets rabies, they may experience symptoms such as fever, headache, and agitation, progressing to hallucinations, paralysis, and ultimately death if not treated promptly. To avoid getting rabies, keep in mind the following steps. 1. Ensure pets are vaccinated against rabies. 2. Avoid contact with wild animals. 3. Seek medical attention if bitten or scratched by an animal. 4. Consider pre-exposure vaccination if working in high-risk professions like wildlife rehabilitation or veterinary medicine. Mumps. Mumps is caused by a virus that commonly affects the parotid glands, leading to swelling around the jaw area. Symptoms of mumps vary, with some experiencing mild cold-like symptoms, while others may have fever, headache, and fatigue. Children with mumps should stay home for 5 days from the onset of symptoms and rest adequately. The incidence of mumps has significantly decreased due to the availability of the mumps vaccine. Most children recover fully from mumps within approximately 2 weeks. Measles. Measles is a highly contagious viral infection that primarily affects children. It remains a major public health concern, causing over 100,000 deaths per year worldwide. The Persian physician Rabies gave the first clinical description of the disease in the 10th century, clearly differentiating it from smallpox. The viral nature of this disease was demonstrated in 1911, and the virus was identified in 1954 by Thomas Peebles and John Enders. The measles virus spreads through the air and can remain contagious for several hours. People can contract it by breathing in contaminated air or by touching surfaces with the virus, and then touching their mouth, nose, or eyes. Symptoms of measles typically appear 10 to 14 days after exposure and include high fever, cough, runny nose, red eyes, and a characteristic rash that starts on the face and spreads to the rest of the body. There is no specific treatment for measles, but supportive care can help manage symptoms. This includes rest, hydration, fever-reducing medications, and vitamin A. The most effective way to prevent measles is through vaccine and is usually administered in 2 doses, starting at around 12 to 15 months of age. Ebola. Ebola is a virus that causes severe inflammation and tissue damage throughout the body, known as a hemorrhagic fever virus. It can disrupt the clotting system and cause internal bleeding from small blood vessels. 6 species of the virus exist, with only 4 known to affect humans. Ebola spreads through direct contact with infected bodily fluids such as blood, saliva, and urine. Transmission can also occur by touching contaminated objects. Individuals who have been in regions where Ebola is prevalent or have interacted with infected animals are at risk of contracting the virus. Early symptoms of Ebola resemble flu-like symptoms, including fever, chills, weakness, severe headache, and muscle aches. Later symptoms may include confusion, chest pain, and gastrointestinal issues. Treatment for Ebola remains challenging, but certain therapies are available for specific strains. Supportive care is essential in managing the disease. Hepatitis. Hepatitis is inflammation of the liver tissue caused by the virus hepatovirus A, B, C, D, and E. Other viruses can also cause liver inflammation, including cytomegalovirus, Epstein-Barr virus, and yellow fever virus. It may also be caused by alcohol consumption, several health conditions, or even some medications. There are 5 viruses that cause the different forms of viral hepatitis. Hepatitis A. It is mostly a foodborne illness and can be spread through contaminated water and unwashed food. Hepatitis A is the least likely to damage the liver and completely resolved within 6 months. Hepatitis B. It can be transmitted through exposure to contaminated blood, needles, syringes, or bodily fluids, and from mother to baby. It is a chronic disorder and in some cases may lead to long-term liver damage, liver cancer, and cirrhosis of the liver after many years of carrying the virus. Hepatitis C. It is transmitted through infected blood or from mother to newborn during childbirth. It too can lead to liver cancer and cirrhosis in the long term. Hepatitis D. It is only found in people who are also infected with hepatitis B. It is predominantly found in Africa, Asia, and South America. Symptoms of hepatitis may include loss of appetite, abdominal pain, dark urine, joint pain, yellowing of your skin and eyes. Hepatitis can be lethal, particularly if left untreated, leading to liver damage, cirrhosis, or liver cancer. Treatment options vary depending on the type and severity of hepatitis, ranging from antiviral medications to liver transplants. Prevention includes vaccination for hepatitis A and B, avoiding sharing needles, and practicing good hygiene, such as washing hands regularly.